Hi, my name is Amy Barrall. I'm a physical therapist with Manheim Township School District. I work with students from really pre-K, entering kindergarten, through age 22 when they leave special education or graduate. I particularly enjoy just the variety. Because I have little ones and I have older ones, I get to follow them all the way along the pathway. So really working in the older grades helps me to develop a plan and a long-term trajectory for some of the younger kids. It helps me to answer questions for parents because I know what's coming up. I wear a lot of hats. I work in elementary schools developing goals that give children access to their education. We're trying to keep them in regular ed as much as possible. And so positioning, standing, different equipment, practicing gross motor skills that are age developmentally appropriate so that they can be included in recess and gym class and in their morning meetings and in their classroom spaces. If I had to pick one area where we work probably the most, it would be to try to promote independence, whether that be mobility, whether that be a task in the classroom, just the goal of being safe and independent. That kind of trumps everything. It's really hard to put a monetary amount on the flexibility. I get to create my own schedule, I get to work around, and that works for the benefit of both me and for my district. High school starts early, I'm not in contracted hours. I can do a high school start at 7:15 on any particular day, but I can stay for an elementary school IEP meeting that goes till 4:30 or 5. So we both win on that. But then if there is a day where I need to leave an appointment, I can do that as well. Unlike outpatient where you only get a half an hour, you're bound by the clock, you need to get things in, you need to show progress. I get to be with kids for the whole year. So I get to work on something for the long haul. And that gives us the flexibility to have a session that's really fantastic, and then a session that's maybe not as fantastic, but I still really learn something. They're kids, they never go according to plan. Like your sessions never really go exactly as you plan. You always have to be flexible and just, work with them and kind of capture an opportunity that is, presents itself. This is a teachable moment. Let's just roll with it and let's throw out the plan that we had today because this kid's doing something that's really exciting and I want to reinforce that and I want to encourage that. But a lot of our kids have medical issues that their speed of learning or developing that skill just needs a lot of time and a lot of repetition and a lot of one-on-one time with me or staff. And we get to have that. When you're in outpatient or hospital, PTs are having to give away that one-to-one time to a PTA or to a group. But I get to do that every day with, very specific kids working on very specific skills. And I really like that.